Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, welcome to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. As always, it's a pleasure to be spending this time with you. This week, we're discussing the integration of population health, prevention, health promotion, and wellness activities into clinical practice. With decades of research supporting the benefits of lifestyle changes on positive health outcomes, physical therapists and other health professionals are exploring and weaving integrative and lifestyle medicine into both insurance and cash-based practice settings, as well as community health and serving private sector business. Lifestyle changes, including physical activity, nutrition, stress management, all lead to improved health benefits in those with chronic disease and prevent or manage a number of non-communicable diseases, which lead to an increased quality of life. Physical therapists are well positioned to treat non-communicable diseases through the integration of population health, prevention, health promotion, and wellness activities into clinical practice. Joining us today to discuss the topics of health promotion, prevention, wellness in physical therapy practice is Professor Dawn Magnusson. Dawn is an assistant professor in physical therapy at the University of Colorado. She received a master's degree in physical therapy and then went on to pursue a PhD in population health sciences. Her research employs community-based methods within a population health framework and inform the development of innovative community-based solutions to advance health equity for underserved children. On today's episode, you'll learn all about population health, why physical therapists should care about population health, what the integration of population health and physical therapist practice looks like, how disease prevention, health promotion fit into population health, and how physical therapists can become more active in population health, disease prevention, as well as health promotion. Okay, this is a big and important topic that has implications both for entry-level physical therapy education as well as clinical practice. So let's get ready and let's begin with Professor Dawn Magnusson. Hey there, Dawn. Thanks for joining me this week on the podcast.
Hi, great. Thanks, Joe. Thanks for having me.
I was on PubMed doing some searches on different things related to health promotion and actually health coaching, and this popped up. And I was so happy to see your paper, and it's really brand new, and I want to make sure that everyone can access it because it's a great read, I think, for clinicians as well as educators, of course. A lot of this applies to educators. So this was in PT Journal, April of 2020, and the title of the paper is Population Health, Prevention, Health Promotion, and Wellness Competencies in Physical Therapist Professional Education, Results of a Modified Delphi Study. And it's a big study. It's like 35 pages. So congratulations. I know these things take a lot of work and effort from yourself as well as your other co-authors. Tell me first how you became involved in population health. I know you have a long history in this.
Sure. I always struggle with how to answer this question just because it's kind of how far back do I feel like I need to go. But I think it is helpful for people to understand kind of how I was first introduced to the concept and why I became interested in population health. So I actually worked as a pediatric physical therapist for over a decade. And I loved that job. I loved working with children. I loved working with families. And I could never have imagined doing anything else. But, I guess with life in general, I was kind of starting to get concerned about, maybe frustrated by some of the differences with regard to the quality of care that some of the children were receiving. But on top of that, kind of, frustrated by my inability to kind of better support families in providing more nurturing environments for their children. And so, I came to this kind of fork in the road where I could, just kind of keep going through life and just kind of doing the status quo or actually do something about it. And I'm more of a kind of let's do something about it versus just kind of sit by. And so I didn't really know what to do, but I happened to be living in Madison, Wisconsin at the time and enrolled in a global health program, certificate program, because, that talks about health equity and health disparities and things like that. I'm like, well, that's kind of in the ballpark. It turns out that a lot of these courses were offered in the Department of Population Health Sciences at the University of Wisconsin. And again, I had no idea what that meant at the time. But, I kind of, started looking into the program. They had a number of different programs that were available. And it just really seemed to fit the kind of training that I was looking for at the time in terms of, one, just really better understanding the populations that I was serving, but more importantly, really developing the tools and kind of strategies to address, some of those underlying challenges and issues that families were facing. And so it was a perfect match for me. I ended up returning to school full time, which was kind of a big shock, again, from this job that I truly loved. But again, it was the right decision at the time just to really understand how I could be more impactful in this area.
All these topics are becoming and actually are very popular right now, not only in physical therapy, but in many health professions. Some of it kind of spurred by the World Health Organization. But just give us an idea, when did you go back and study and how long ago was that? Because you probably were a little bit ahead of the curve.
I'd like to think so. It was kind of, it all happened somewhat happenstance, but, people are like, no, Dawn, you were a visionary. I'm like, well, I was just trying to do something that felt right to me. But I appreciate people saying that. But so I returned to school in 2010. And, I would say, the term population health management has really been around since the mid 80s. But it certainly received more attention kind of in the early 2000s, and, became a big player kind of, during that time, kind of probably around 2003 through 2006 or 7. So I was kind of at the early end of it, in terms of training and things like that. So I consider myself to be quite fortunate in, kind of doing that. But again, I feel sometimes like I fell into it more than I was like trying to be some visionary. But, certainly it's helped me in not only my practice, but my career as well, just, trying to impart, this knowledge for other folks as well. So, yeah.
And I think the connection to pediatrics makes sense because any pediatric health professional I've ever spoken to says, well, you're not only treating the baby or the child or the adolescent, but you're really treating their entire family. So I think you probably, out of all the different types of practitioners, start to get a sense of there are bigger things going on here than just the patient in front of me that I'm treating. So I like that entry point.
Yeah, for sure. And I would add too, when I talk to folks from different practice areas, I feel like pediatrics and home health are definitely, the two that people are like, oh yeah, this makes perfect sense that we need to kind of be thinking about these bigger factors. Yeah.
So I want to just go through a couple of definitions. You don't have to give us long definitions, but these terms, health, wellness, population health, health promotion, are thrown around a lot, and they're in the title of the paper. So first, give us a definition of what population health is. Sure.
So, a lot of definitions have been floated around. Like I mentioned, the term was kind of first really popularized back in the mid 80s by Jeffrey Rose, but it's really kind of gone through somewhat of an evolution, and you'll find lots of different definitions. I think, when it comes down to it, population health for me is really, I think of it as an approach to, using data, whether it's qualitative, quantitative data, using data to examine differences in both health outcomes and related factors that contribute to either an individual or a population's health, really with the ultimate goal of eliminating those health disparities or health differences through, better informed interventions, practices, and policies. So that's for me what population health is in a nutshell. It's really an approach to understanding our populations and really serving them in a more well-informed way.
And of course, important, we're actually recording this April 28th. People know my podcasts don't come out for a while, but things like population health and social determinants of health are important as we are still in the midst of COVID. Hopefully by the time this airs, we'll be out of that and we'll be returning to somewhat normal life, but we still have a lot of population health challenges with regard to healthcare in our country.
We do. And I think, I've been talking with some colleagues about, our current situation. And I think, whether for good or for bad, COVID-19 has really shown a spotlight on some of the disparities within our nation, within our country, and, thinking about those social and more structural factors that contribute to our health. And, my hope is moving forward, again, we can take that information, really use it and leverage that to, again, just provide better care and resources for our communities, certainly.
Yeah, well said. I know in our country, it can be difficult to collect data because we don't have a nationalized health system. But so far, the data that's come out of Italy has told us that 99% of people who die from COVID have at least one pre-existing condition, one non-communicable disease, basically. And more than 50% of them have two or more. So really important topics. Okay, so let's go into the second definition. We're going to go through these definitions. I think they're important for everyone to give some context to the rest of your paper. Sure. We mentioned population health. Let's do prevention. So what is prevention?
Sure. So I kind of like to think of prevention and health promotion. So if we think of population health or population health management as kind of an approach to understanding and addressing health issues within populations, I'd like to think of prevention and health promotion as kind of, those methods, those tools that we can use to actually optimize, again, the health of our individual clients as well as the health of our populations. And so generally speaking, prevention really refers to those efforts aimed at reducing the development and severity of acute and chronic conditions. And as well as related risk factors. And so there are we think of like 4 levels of prevention, all the way from primordial prevention, which is kind of looking again at those kind of social and structural contributors to our health, all the way to tertiary prevention, which if you can imagine a triangle, that tertiary prevention is the very top of that triangle, which really is, I think of as more of those healthcare services, traditional rehabilitation services that we provide to individuals who are already sick, are symptomatic, and really we're trying to minimize their long-term disability and improve their quality of life. So that's kind of prevention in a nutshell.
And then health promotion?
Sure. So I like to think of health promotion as kind of the opposite side of the coin, if you will. Prevention is on the one side, health promotion is on the other side. And a lot of folks kind of equate health promotion to more primordial prevention. I didn't talk about that in my definition, so folks can kind of go and look that up. But, really it talks about looking at our communities and looking at the structures within our communities and really empowering and giving people the tools to improve their life. And working, again, not doing something for or to the community, but really working and walking alongside our community members, again, to improve the health within that community. And so I think the other part that health promotion brings in is really, it highlights the importance of intersectoral collaboration. So whereas prevention tends to be focused in the healthcare sector, health promotion really brings in those other sectors like education, housing, urban development, how we can develop partnerships with those folks as well, again, to really promote the health within our communities.
Excellent. And the last one is wellness. It's it's probably the most vague term, I believe.
Yeah. And that's one I don't always have like the best canned response, but I really think of wellness, if we think of at the individual level, if we think of what wellness means, it really means, thinking of our physical health, our spiritual health, our mental health, kind of that complete state of, again, just having all of those different pieces and all of those aspects of our health kind of working together so that we're able to function at the top of our level and kind of fulfill our societal roles or whatever that looks like. So again, wellness, bringing in all of those different aspects of health into kind of one piece.
So for example, like your physical, emotional, spiritual health might all fall into the wellness category.
Yeah, that's how I think of it. Yep. Mm-hmm.
So this is the large studies I mentioned before. Tell us what the aim of this study was. And this was a modified Delphi study. Tell people what, first what the aim was, and then second, what a Delphi study is and how that works.
Sure. If I could, I might just offer a little bit of background for kind of how the study came about to begin with. So I worked with folks who are part of the APTA Council for Prevention, Health Promotion, and Wellness, the education task force, I guess, of that group. And we originally did a survey of entry-level physical therapist professional education programs to understand what are people teaching in this space, what are their needs in the space, just to kind of understand more the landscape of these topics across programs across the country. And what we found is it's kind of the Wild West, as you can imagine, in terms of both the depth and breadth of content covered. I won't get into that too much, but one of the things that folks identified as a key barrier is we don't even really know what we're supposed to teach in this area, in this space. Yeah. And so we thought, well, we should come up with some competencies. And so really the purpose of this current study was to really convene experts from around the country and think about what would entry-level competencies look like in population health, prevention, health promotion, and wellness. And so that was the impetus for the current study. A modified Delphi study just means we as the study team kind of looked across all of our professional documents, literature that had been published before, and started coming up with a preliminary set of competencies, or at least areas to consider. So that's the modified part. And then that was basically given to our study participants who went through multiple rounds to kind of refine and narrow down that broad list of competencies into the final one that's published in the paper.
I see. That's why it's modified versus, let's say, a regular Delphi study would be you would go directly to the experts and they would come up with the specific criteria, let's say.
Exactly.
Yeah. So you gave them a little bit of a head start on what they're looking at.
Exactly. And they were also within that process given the opportunity, if they felt like anything was missing, to certainly add that in. So they weren't limited just to the competencies or, the list that we had created. It was certainly within their ability to kind of add things, especially if they felt important things were missing.
Yeah. And I just want to ask one quick question, because you brought up an important point of there's a wide breadth, but not so much depth of what's being taught out there. Do you have an idea? I mean, I have a little bit of an idea myself, but do you have an idea as to, do current DPT programs in the United States of America, let's say, are they required to have a health and wellness promotion class? Is it something that is seeded and spread throughout the curriculum? What is the kind of variation of what you know out there?
So my understanding is programs are required to provide some level of health and wellness content. But that's very vague. It's kind of, a couple sentences in the CAPTI criteria. We certainly have our professional position statements that talk about these things, but it's quite vague. It's, essentially, and again, I'm paraphrasing, but it's, programs will provide content in health and wellness, let's say. And so that doesn't really give a lot of guidance, in terms of if we look at some of the other practice areas, they're very specific. If we look through those CAPTI criteria, very specific, students must do X, Y, and Z. And those aren't quite as established in this area, again, because it's a relatively new area, I think, in physical therapist practice, and something that folks are still kind of wrapping their mind around. Now, having said that, there are folks in the physical therapy world who've been doing prevention, health promotion for decades. So I don't want to take anything away from those folks. They were way trailblazers back in, the late 70s, probably early 80s. But again, as a profession, really trying to wrap our minds around what does this look like for entry-level education.
Right. So for example, if a DPT program director is listening to this, the takeaway is that there is currently no requirement to have a single class on health and wellness promotion, or to have a single class. There's no requirement for that, let's say.
No, I wouldn't say for a single class. And again, in the previous survey that I referenced before, all programs are providing this content, but what that looks like is quite different. Like for me in Colorado, we have one class, a 3-credit health and wellness class. Some programs offer 1 credit. Some programs kind of scatter that throughout the program. And so what that looks like is very different from program to program. And so I'm not aware of a minimum like credit requirement for this content or how that should be structured, again, within programs.
Yeah, I know CAPTE doesn't provide a credit requirement. They just provide those competencies, right?
Exactly. Yeah.
And as we touch on that, I'm kind of jumping around a little bit because this topic excites me. Talk to me about the difference between between competence and a competency.
Ooh, that's a good question. I think in terms of competencies, I view competencies as these are the skills that students, you can have competencies, I guess, at any level of education, whether it's entry level, residency, or, beyond that, expert clinician. And so competency, I think of, is that defined skill set, knowledge, attitude that student, that learner must demonstrate, enable to say, okay, they are competent in X, Y, and Z. So that's how I kind of distinguish the two.
Okay. So you had this study, you go out to experts. Tell me who the experts are. I think that's important for us to know. How many were there and what did they look like?
Yeah, so we were very, intentional in the way that we approached our experts. We really wanted to reach out to folks, again, representing the many different practice settings where you might find physical therapists as well as educational programs. And so we were very intentional in, again, finding a nice broad range of folks to participate in this study. And again, it wasn't all professionals who even have a background in health and wellness or prevention or things like that. Again, we really wanted to kind of try to get a nice cross-section of folks from around the country. And so I'm just looking back at the actual numbers. So we ended up inviting 40 members to participate in the session or in the study, sorry. And so again, those folks represented pediatrics, orthopedics, all sorts of different practice settings. But they also included folks with varying years of experience. So we had a number of folks who were relatively new, kind of relatively fresh graduates. But we also had some folks with, over 25 years of experience, again, whether it was teaching or in a clinical practice. I think at the end of the day, we had, of those 40 folks, 37 completed all 3 rounds of the study. So yeah, that's kind of our participants in a nutshell. Many of them had advanced degrees. So whether that was, that included a PhD or an educational doctorate, some kind of higher level. A number of folks, had some sort of additional degree behind their name. But again, really representing a pretty broad and diverse group of folks.
Okay, great. And then give us an idea of what the results are. I know, again, big paper, but there's a couple of key points here. There are 3 broad categories that you mentioned in the paper. I think that's useful. And then we can kind of maybe, dip down into some of those categories.
Sure. So the 3 broad categories that we ended up kind of classifying the different competencies fell under the biggest one that is probably most relevant to practicing clinicians is this clinical and community preventive services and health promotion. So in that space, we also had a bucket that was kind of foundational population health knowledge. And that really brings in concepts like epidemiology and just kind of, thinking about that bigger picture. And then the third bucket included competencies related to health systems and policies. So again, thinking about kind of the bigger picture, what should we expect our students to kind of demonstrate in this space? So those are our 3 big buckets.
They are big, but those 3 topics right there are quite large. Like, as you mentioned, I'm like, I kind of feel like we need more than a 3-credit course to cover this.
Right. I certainly wouldn't argue with you. I think I think a strategic way to approach that is really finding meaningful ways to integrate this content, these ideas, throughout the program. So I personally don't know that a standalone course is the right way to go, even though that's what our program currently does. But I really think there's value in finding creative ways to, again, integrate this information just into everything else we do, because I mean, it's the topic, it's population health, and everything else kind of falls under that umbrella, in my opinion. So something to continue working on, but yeah.
Is the university you teach at, is it a problem-based learning, or is it a more traditional approach to?
I would say it's a little mixed, depending on the course. So yeah, you see kind of classes run the spectrum depending on kind of, again, the individual course goals, or not even the course goals, but, the learning goals for specific activities and things like that, and skills. Yep. With regard
to the competency, what kind of surprised you? So these experts are commenting on things, and maybe things you thought, well, wow, I thought they would have included more of this, or maybe taken this out. What were the surprises that you found when these experts started to opine on it? Yeah. So I think maybe one surprise, I don't know if maybe a little bit surprising. I think a lot of the competencies or descriptions that we originally included, almost all of them were perceived by the study participants as being very relevant and important for physical therapist practice. Where a lot of folks kind of put on the brakes was, this is really important, but not an entry-level skill. Like, these are things that students should learn, kind of as they progress in their career and as they, develop those skills. But almost everything, and I'm trying to think of if there was anything that was like, no, that's not even physical therapist practice. Like, nothing like that got completely, wiped off. Really, the reason for limiting the competencies had more to do with just entry-level practice versus more advanced practice skills. So again, perhaps not a surprise, a pleasant surprise, if anything. So that was really great. I think, certainly as with anything, there were a variety of opinions. There were some people that felt strongly that some things should not be included and fell outside of our scope of practice. But again, that was maybe one or two individuals. And so if we think of, the process of the Delphi study, we were quite rigorous in terms of making sure we achieved a certain level of consensus in a couple of different ways. And so again, we had some people that, were super excited about some, very advanced level competencies in my mind that were like, yes, students need to know this. Like, well, no, maybe they don't. And other folks that were like, this doesn't even fall in physical therapist practice. I'm like, so there were, again, those extreme views. So I feel like we came up with a pretty good kind of comprehensive list that takes into consideration all those different factors, but that really kind of reflects, again, that core consensus. Yeah, it's a very comprehensive list, and everyone, of course, it's listed beautifully in your paper, which I think is great for educators to access. So if they have a course or they're seeding it throughout the program, they can look at that. Can you give us an idea of some of those extremes that you're talking about? I'm curious to hear what the extremes were. Something that someone thought was should be part of entry-level practice, but other people thought this is really something that physical therapists learn about as part of like continuing education or as they advance their career. Mm-hmm. So I think one thing that comes to mind immediately was the idea of our role in community-based prevention and health promotion. And so one of the competencies, and I'm not going to remember it exactly, but it was essentially conduct a community-based needs assessment and develop a community-based health prevention or health promotion plan. And so really kind of developing those things. Again, that's something where some people felt very strongly, oh yeah, students need to know how to do that because we need to get more engaged and involved with our communities and work alongside them. So we had kind of that camp of folks. And we had, a couple people on the other extreme that were like, no, that's not within the physical therapist scope of practice. Like, those aren't things that we should be focusing on. And so that's one example where, again, that competency ended up not being included, but you had folks on kind of the two extremes of that. So that's probably one example that comes to mind where, again, you had really differing opinions.
there was some conversation, and folks will see when they look at the paper, they'll be able to see kind of the process that each competency went through to either be accepted or rejected. And so just to give, folks an idea. So there were some, let's see, I'm thinking back to some of the ones that ended up not being accepted that maybe was a little bit of surprise to me. And that was around kind of our involvement or understanding of urban development and rural development, I guess, too. But just thinking about the spaces that folks have access to be physically active. I feel like that's a space, that's our wheelhouse, is physical activity. And if people don't have spaces to be physically active, so I was a little surprised that that one didn't kind of pass through, just again, understanding that urban design element. Because I know there are a lot of PTs around the country that are really heavily invested in that space. And that was one that had a little more feedback, like, I don't know if we need to get involved in that space. Whereas, again, the other half was like, yes, of course we need to, students need to, so that was another one, kind of urban design, or just thinking about, again, the spaces where our clients have access to.
That's an interesting topic, because that urban development piece starts to kind of bump up against like almost the American with Disabilities Act, which years ago was a big deal. Mm-hmm. And a lot of physical therapists were actually involved in that and still are involved in that. So that's interesting. And it also bumps up against environmental considerations, which people are very passionate about nowadays, like making sure that there are parks that are included when towns are built and developments are created. So they're interesting topics that people may or may not be behind, of course.
Mm-hmm. Yeah. And I, thank you for referencing the ADA, because that, in my mind, when, that competency was originally, part of the plan, I thought, oh, well, this will probably be a no-brainer given our history of looking at, spaces where people, need to access and things like that. So anyway, thank you for bringing that up.
So on this podcast, we talk a lot about nutrition. I've been talking about nutrition for decades, and people know I'm passionate about it. A lot of people who follow the podcast are passionate about it. I'm happy to see that nutrition, communicating nutritional guidelines, does show up as a competency. And actually, it was rated very high as relevant by your participants. 88, almost 89% felt it was relevant, and it is a big yes in the final competency. So the way it reads is to communicate nutritional guidelines set forth by the federal government to clients as a means of promoting healthy eating, communicate nutritional recommendations set forth by state, national, international agencies as a means of promoting healthy eating patterns. Awesome, because nutrition is part of our scope of practice per the APTA.
Right.
It hasn't quite been rolled out the way we'd like it to be state by state. So there's passion there and debate a little bit about it as well. I've talked to many state boards who say, oh, well, that's part of health and wellness promotion. And I think it is. And this paper actually says it is, which is awesome. My question to you is, do you feel that state practice acts should put more specific information with regard to nutrition, or should we just leave it vague and say, well, health and wellness is, nutrition's part of health and wellness promotion, which is part of what we learn in school? Do we need to really clarify it for people?
I think in some ways we do, just because, and again, I think I've looked at a link that you provide from your site that kind of breaks down each of the state practice acts, kind of what they say in this regard. And I think when nothing is said, then that's certainly open to interpretation as yes, we should, or no, we shouldn't. It doesn't say we can, and therefore we shouldn't. I think
you can't either.
Right. Exactly. And so it depends on kind of your outlook. If it doesn't say anything, well, all right, let's do it. Or if it says, well, but we didn't get permission, then people are like, okay, so maybe we shouldn't do it. So I do think there needs to be a little more clarification, and certainly language that specifies, yes, it's okay to, do this aspect of it. And again, I think I've spoken to many registered dietitians. We have some that come, they're a great group that comes and talks with our students. And they're like, yes, please give patients basic nutritional information. You see them way more than we ever will. You spend so much more time with them. Please give them basic nutritional information. And, I kind of equate it with other aspects of our practice. And, there's a professional scope of practice, but there's also an individual kind of personal scope of practice. I think we should all be comfortable giving basic, like eat more fruits and vegetables kind of language and information that's published by the government, the federal government. And then beyond that, it really depends on our own the skill set that we've developed in that space. And, ultimately we reach a place where, this is outside of my personal and perhaps professional scope of practice. Let's bring in an RD, or let's bring in an expert who can help us consult in this situation. So it's just like any other area of our practice where, again, we have to understand our own kind of boundaries and limitations and kind of practice within that, and then refer out if we need to.
And nutrition is in CAPT requirements now that does specifically say nutrition. So
right.
it's hit CAPT. It's hit a lot of parts of our research. Elizabeth Dean's been a big advocate talking about it on many different stages, and of course producing some really good literature with regard to it. My question, so the national nutritional guidelines, if you speak to most, and there's a little bit of controversy around this, if you speak to most nutrition professionals, they'll tell you, well, the guidelines are good, but they're pretty baseline. They're the baseline of what people need to follow for baseline health. The example is the nutritional guidelines through the USDA is to eat 5 servings of fruits and vegetables. Doesn't say how many, if it's 2 vegetable and 3 fruit, or 4 fruit and 1 vegetable, doesn't tell you. If you go to some other organizations, they'll tell you 5 is not good enough. You actually need to hit 9 to start to get the nutrients that you need. As physical therapists, we are treating people with non-communicable diseases. So can we start to go beyond those basic nutritional guidelines and say, well, I think for this person, maybe a Mediterranean diet is going to be better for them? These are topics that we may not have an answer to right now in the podcast, but I think they're topics that both you and I are starting to discuss in various circles.
Yeah, no, I agree. I feel like each year when I've taught this course, this will be my 4th or 5th year, I forget now, we learn so much more about the connection between the foods we ate and chronic inflammation. And so I think as we learn more and more about that, the connection between the two is becoming so clear that I agree. Recognizing, especially for those patients that, maybe it truly is the food they're eating that is kind of influencing their recovery and kind of slowing their pace of recovery. Could that be a factor? And is that something we should look at? I definitely think, again, as we're learning more about this connection between the two, it'll be really important for us to pay attention to the research and literature that comes out there, because certainly all arrows kind of point to there's a strong, strong connection there. Mm-hmm.
And everything we're talking about revolves around behavior change, or a lot of it's behavior change. Yet I was reading somewhere in your study, you made a really important point that behavior change doesn't necessarily show up in CAPT requirements so well.
Yeah, it's interesting. I think, again, maybe one of those areas where it's kind of implied
yeah, that's right.
in different ways. Yeah. But certainly, when I think of, and again, it could be around prevention, health promotion, kind of individual behavior change there, or even just working alongside a client to get them to do their home exercise program. Like it's all around their behaviors. And so how do we, again, walk side by side along our client in that journey to understand what are the factors that are allowing them to kind of make that healthy choice, the easy choice, or are there other, things that are kind of limiting that? Again, are there structural barriers? Are there things in their environment that's kind of limiting that? So again, it kind of comes back down to the basics of really just understanding your client, listening to them, probably talking a lot less and listening a lot more to really understand their story and how these different factors are influencing their choices and, kind of their health trajectory.
Yeah. One of the reasons why people pursue a PhD is to change the profession. So you now have this, in addition to other studies you've already done, you now have this wonderful 35-page report on population health prevention, health promotion, and wellness competencies for physical therapists. Let's kind of go down the list. How would you like to see CAPT apply this information?
Ooh, that's a great question. I think I think what would be helpful to educators is just having more direction in terms of both the breadth and the depth of information that ought to be covered in programs. And just, I think people are just looking for more guidance at the end of the day.
More detail, right?
Yeah, a little more detail, just a little more guidance. Because again, the other feedback we heard from folks, again, in that preliminary study is that our curriculum are just jam-packed. If we're going to add this, then we need to take away that, and so programs are really struggling with, again, then where do we put this information in? And maybe that's where we can be a little more strategic and intentional about, it's not another thing to add, but maybe we can really weave it in ways that make sense. And again, that get at some of these really core issues that we as a profession really need to kind of get on board with and up our game. So I guess maybe that would be helpful. Again, just a little more guidance for folks would be helpful.
How would you like to see clinicians use this work?
Oh, man. It's interesting because I'm right now working on putting my course online for my summer course. And I'm kind of in the weeds of, kind of, again, integrating population health management, disease prevention, health promotion in practice. And I think, even for clinicians, practicing clinicians to take a step back and think about how can I understand my population more, and I remember this as a clinician, I would, I viewed each child and family as kind of that individual basis. Like, here's what you and I are doing today. Okay, I'll see you next week, or, and I never stepped back to think about what do these families, what do these kiddos have in common that maybe we could start to identify some patterns and just use that information in a way that, one, could certainly benefit them, but two, really allow us to practice in a way that's more efficient and effective, especially as many of our payment models are moving away from fee-for-service to value-based care. We need to become much more efficient and effective in the way that we do that. And that only happens, again, if we look at our clients at the population level, to kind of see what's happening. I know a lot of folks, again, I think a more tangible, concrete way that folks are applying population health management approach in their clinical practice is to use data about their clients, about their patients, and identify those folks that are maybe at really high risk for having a poor outcome and say, okay, we need to do things differently with them because what we're doing isn't working. So that's, kind of a basic step for, applying some of these principles and approaches versus, those folks that are low risk, you give them their home program, they go off and do it and they get better. So again, how can we just be a little smarter and more efficient with our time and resources, I think would be great. Good start.
As you mentioned, the payment models and values-based care, for those higher at-risk populations you're talking about, a lot of this with regard to prevention, health promotion, population health, wellness, it's facilitating things to happen outside of the physical therapy clinic, which is a very new concept for a lot of professionals.
Yeah, I completely agree. I think, and I don't know if this is a physical therapist thing or what it is, but we feel like we have to do it all. And maybe other professions are like that, but I certainly get that feeling like, how am I going to do all this? I can't address, what they came in here, their shoulder hurts. So I need to address that. How do I address all these other things? It's like, but you don't have to. And that's where, I think we're somewhat comfortable referring or, kind of building that network within the healthcare sector. So referring out to, a surgeon or whatever folks we need to there. Where I've seen folks really excel in this space, this population health management space, is finding those key kind of community resources, maybe outside the health sector, where they can, connect with them as well. And so, if you find a large, and this is just kind of an example off the top of my head, if you find a large number of your clients are struggling, to make their mortgage payments or their rent payments, there are a lot of communities with amazing resources that are completely underutilized, where, if you could start identifying some of those community resources, okay, well, here's a phone number for this agency that could help you in this way. Let me know if you need help calling or getting connected. And so again, looking beyond the health sector for some of those really key, I think community resources would be a great step too.
Yeah, as we're talking, one of the things that keeps coming to my mind is we're so used to working in that fee schedule based on seeing someone billing out a couple of codes, seeing someone billing out a couple of codes. Where's the opportunity for physical therapists with regard to, let's say, financial opportunity with regard to health and wellness? Because of course, new grads are coming out of school, they have big loans, they want to be able to make money. How can they apply this in a way that can obviously put money in their pocket as well as help the promotion of health in their communities?
Yeah, I think an example that comes almost immediately to mind is the role that physical therapists can play, again, as a non-invasive intervention, certainly lower cost than surgery for something like low back pain. Like I'm thinking of cervical or low back pain. There have been a number of recent studies that have shown, physical therapist services in that space save health systems oodles of money. So talk about value-based care. Physical therapist services are such a high value service in that, given the price, outcomes are tremendous, when they're applied. And so I think, when it comes to health systems, looking for those opportunities to really demonstrate our worth and demonstrate our value is going to be really critical moving forward, especially now that, a lot of those decisions are being made by folks maybe without the knowledge of, what it is physical therapists do. Yeah. And so I think we have a real opportunity and probably an obligation to, again, demonstrate our value. Again, not knocking down doors and, kind of bullying our way to the table, but really just showing like, hey, when folks get our services, look at how much money we save the system and look at how great the outcomes are. Like that's true value-based care. And we have so much potential in that space. I hope we can just, better strive to achieve that potential.
So examples of that might be a physical therapist can consult with a local insurance company, or a physical therapist consult with a large employer who self-funds their insurance and notices that many sick days are missed each year based on lower back pain. How can we bring this down? How can we bring down sick leave? How can we bring down our workers' compensation claims? Those might be ways where all this can be applied. And obviously when you're saving a company money, they're more likely to want to pay you and obviously hire you as a consultant.
Yeah, and I would, if folks are interested in those examples, the APTA through their employer initiative have a number of great resources and talk exactly about that, where physical therapists are really starting to, kind of demonstrate their worth and value in that space. And Mike Eisenhart has done a lot of work around kind of employer-driven initiatives in this prevention health promotion space. So it's another great example.
Yeah. So it's a great paper. Of course, we're going to link to it in the show notes so everyone can access it. It's in PT Journal 2020. Again, the title is Population Health Prevention, Health Promotion and Wellness Competencies in Physical Therapist Professional Education, Results of a Modified Delphi Study. Everyone will check it out. And of course, they heard a whole bunch today on this episode. If they want to learn more about you and the great work you're doing, how can they contact you?
Sure. They're certainly welcome to check out my faculty profile at the University of Colorado. That site, that page contains certainly my contact information, a little bit more background of, kind of the research that I'm involved in. And so they're welcome to check that out and certainly reach out to me anytime.
And we'll link to that in the show notes, so you can link directly to the faculty page there at the University of Denver, Colorado. I want to thank Dawn for joining us for the Healing Pain podcast this week. Again, make sure to check out her paper and, of course, share this episode with your friends and family. I'm Dr. Joe Tatta, and we'll see you next week.
Thank you for listening to the Healing Pain podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.